Cancer can be a really scary thing because it seems completely out of the way control. However, what if you possessed more influence over your cancer than you realize? In this video, we will explore 6 indicators of cancer. More importantly, the main focus is to enhance your understanding of cancer, its nature, development, and methods to reduce your susceptibility to illness. Number 1. Fatigue. The number 1 sign can be fatigue. However, it's important not to jump to conclusions, considering the numerous factors that can contribute to fatigue. Cancer is just one possibility among many. Pay closer attention if fatigue persists despite sufficient sleep and rest, lasting for more than 6 months. The development of cancer can deplete your body's resources, as it engages in an ongoing battle against the disease, utilizing vital reserves. However, it's crucial to exercise caution before drawing any definitive conclusions, as fatigue is often linked to factors like stress and inadequate nutrition. Number 2. Pain. Another thing that can be a sign is pain. This includes symptoms like headaches and back pain, particularly if they are chronic and unaffected by changes in body position. For instance, if you experience recurrent back pain, you might find relief by adjusting your posture or position. However, if the pain is caused by a space-occupying lesion, exerting pressure on surrounding tissues, finding a position to alleviate the pain becomes challenging. This situation would be concerning. Now, let's delve into understanding cancer and how it differs from normal cells. Normal cells have the ability to turn on and off their functions. Cancer cells, on the other hand, were once normal cells but have undergone changes that prevent them from turning off. This inability to regulate their growth is one of the fundamental characteristics of cancer cells. Normal cells possess regulatory mechanisms that control their growth, allowing them to grow until a certain point and then stop. However, cancer cells have lost this control, resulting in uncontrolled growth. In essence, normal cells adhere to the intelligence and order within the body, following proper instructions. Conversely, cancer cells deviate from this obedience. These cease to listen and follow the body's regulations. The reason behind this behavior lies in the mutations that occur within cancer cells. These mutations alter the cells, causing changes that we will explore further in our discussion of the various elements involved. If you're finding our video informative and engaging, kindly to hit the like button and subscribe to channel to stay updated on our newest videos. Number 3. Lump. The third symptom to consider is the presence of lumps, which is a well-known sign to many people. Women are encouraged to regularly examine their breasts, and if a lump is detected, it could indicate the presence of a potentially cancerous tumor. However, in most cases, such lumps are benign growths commonly known as fibroids or cysts. It's important to note that breast cancer is not exclusive to women. It is also increasingly affecting men. Additionally, men can develop lumps and growths on their testicles, which can serve as another potential sign of testicular cancer if they notice abnormal changes in testicular development. Number 4. Blood in urine. The presence of blood in the urine, known as hematuria, is a symptom that should be taken seriously as it can indicate bladder cancer, kidney cancer, or prostate cancer in men. However, it can also be caused by more common conditions like kidney stones or urinary tract infections. Inflammation due to toxicity is another potential cause, referred to as iritis, with specific names depending on the affected organ. Inflammation in the bladder is called cystitis, in the kidneys it's known as glomerulonephritis, and in the prostate gland, it's called prostatitis. Understanding the development of cancer starts with the occurrence of mutations, which are changes in the DNA sequence. Each day, the body undergoes around 1 million DNA changes per cell during regular cell replication. With billions of new cells generated daily, errors are inevitable, resulting in an astonishing number of copying errors. Fortunately, the body has DNA repair mechanisms to maintain accuracy. Imperfections in DNA replication are actually necessary for genetic diversity and adaptation. If DNA repair fails, the body initiates apoptosis, a process of programmed cell death. Most mutated cells do not survive as they cannot function properly and are eliminated. However, if apoptosis fails, mutations persist. The immune system comes into play, deploying T cells, macrophages, and phagocytes to detect and destroy abnormal cells, actively searching for deviations from normalcy. If these defense mechanisms also fail, precancerous conditions may arise. It's important to note that a mutation alone does not automatically lead to cancer. Further steps are involved. The development of cancer requires two factors: an initiator and a promoter. The initiator is a stressor that increases mutation rate and severity. It can be attributed to various factors such as chemicals in cigarette smoke, environmental pollutants, exposure to ionizing radiation, or hormonal imbalances. However, the presence of an initiator alone is not sufficient. A promoter is required to facilitate and advance the cancer process. Promoters can involve factors that provide resources for cancer growth or interfere with the body's immune system and its defenses. Even with these factors in place, it takes a considerable amount of time for cancer to develop. The subsequent risks and dangers associated with cancer will be discussed further in subsequent discussions. Number 5. Weight loss. Up to 40% of individuals diagnosed with cancer experience recent and unexplained weight loss. This weight loss occurs rapidly and without intentional efforts to lose weight. It is often, but not always, accompanied by a decrease in appetite. The body's balance and resources become imbalanced, leading to reduced cravings. In advanced stages of cancer, a condition known as cachexia can occur, where the body becomes extensively wasted. This is observed in approximately 80% of late-stage cancers. When discussing substances that promote cancer, it is important to identify factors that contribute to the progression of the disease. Clues can be found in the imaging technique called positron emission tomography, PET. By injecting radioactive sugar into the bloodstream, tumors and cancers, which have a high sugar absorption rate, can be visualized using this method. Tumors have a significantly greater sugar absorption capacity, up to 20 times more than normal cells. This preference for sugar is due to their reliance on glycolysis, a process of sugar metabolism, rather than fat burning or efficient oxygen utilization. Sugar, being a major energy source for cancer cells, raises concerns about its consumption. Pathogens like viruses, bacteria, and fungi can complicate matters, taking advantage of a weakened immune system. If the immune system is compromised by factors like sugar, chemicals, and toxins, pathogens can further exacerbate the situation. Additionally, stress plays a significant role in promoting cancer as the body's focus shifts towards dealing with external stressors rather than internal healing processes. Number 6. Fever. The sixth sign to consider is fever, typically a mild fever that persists for weeks without any cold or flu symptoms. It may not be constant and can come and go throughout the day. In the early stages of the disease process, a persistent fever often indicates a blood-borne cancer such as lymphoma or leukemia. However, if the fever arises at a later and more advanced stage of cancer, it could be associated with other blood-related issues. There is often a misconception that cancer strikes suddenly and progresses rapidly. However, determining the exact start of the disease is challenging. It is now understood that cancer takes a considerable amount of time to develop. The first mutation in a cell does not automatically signify cancer. It is just a mutation. Unfortunately, the progression continues. It takes approximately 12 years from the first mutation before cancer fully manifests. During this time, there are numerous progressive mutations. It then takes around 7 more years for the cancer to reach an advanced stage with metastasis. This is when a diagnosis is typically made, often with the realization that time may be limited. Even with one of the most lethal forms of cancer, there is still a significant amount of time during which the body can take action. Despite the variations in cancer types and individual cases, it can take anywhere from 10 to 40 years for cancer to become a significant problem. This emphasizes the importance of early detection and intervention, as there is often a window of opportunity for the body to respond and potentially affect the outcome. These are all 6 million eggs for you to know about cancer. If you have most of them, contact your doctor to check your health. If you found this video informative and engaging, please show your support by hitting the like button and subscribing to our channel for more useful content. Thank you for watching this video.